4, it's my pleasure to introduce to you Elizabeth Shannon, and she does work for Prestera. Am I right? No. Oh, stop it. Stop it. She also has a group of youth that are going, she will be also introducing, so give a warm welcome to Elizabeth and the Region 4 team. Thank you.
Thank you. Good afternoon. My name is Elizabeth Shahan, and I'm the Executive Director of the Harrison County Family Resource Network. I'm responsible for oversight and the overall direction of the project success, which is the Prevention Services Grant for Region 4. And everyone from Region 4 that's here today, if you could stand and just be recognized because you're an integral part of this grant and how it works across the continuum. All of you. Thank you. Thank you guys so much. They're our team, so this isn't all of my team. There's a huge team across the entire region that we work with, all across the continuum. And part of that team, I would like to introduce the part of Taylor County Breaking the Cycle. They're not all here today. Another half of them will be coming on Wednesday. So visit that workshop. There's a commercial. This is one of Region 4's Youth Substance Abuse Prevention Coalitions. They're part of Region 4. They focus on youth substance abuse in Taylor County, and they're going to be handling our presentation today. Jacob?
Hi, my name is Jacob Culp, and I'm a member of Taylor County Breaking the Cycle Youth Coalition. I'd like to introduce you to my fellow teammates, Gavin Watkins, Victoria Marrero, Matthew Marrero, and Joe Sober. We're going to share a presentation with you guys about our Region 4 success. The region's prevention mission is to collaboratively promote the overall mental and physical health of our region by specifically providing education, building personal skills and habits, increasing capacity, and fostering the environment to prevent substance abuse in our communities. Prevention is proactive. It empowers individuals and systems to meet the challenges of life by promoting healthy decisions. It is an ongoing process that must relate to each emerging generation. So now I'm going to let Gavin come up, and he's going to do his part.
Hi, my name is Gavin Watkins. We'll go ahead and get started. In our county, in our region, there's 13 counties. Starting off is Barber County. In Barber County, they've worked with school counselors to involve youth that have gotten in trouble. These turnaround kids have established positive influences in youth groups. Currently working on drafting and passing ordinances to address some of the substance abuse problems in the county. In Braxton County, working with daycare facilities to implement healthy alternatives for little ones, and based on prevention programs for children 3 and 5 years old. Also, I've held education prevention events in Braxton County community. In Dodgers County, held a small media program campaign with weekly education newspaper articles, held monthly educational presentations to Opportunity GED program with guest speakers and discussions about prevention, addiction, and treatment. In Gilmer County, implemented 2 evidence-based prevention programs in Gilmer County schools, KACM and Second Step. Have provided many opportunities based on educational preventions and relative topics such as bath salts, designer drugs, and prescription drug abuse. In Harrison County, presented at CATCA, had 2 youth panelists on the first ever National Above the Influence Day in partnership with the Youth Coalition HCPP, held an underage drinking town hall event. Sponsored 2 recovery coach trainings in Harrison County. In Lewis County, sponsored a National Drug Take Back Day event. Lewis County law enforcement has made several large drug busts since January 2013. community members also more engaged and concerned about drug-related issues affecting the community. In Marion County, hosted community education and awareness events, including substance abuse town hall, Child Watch Awareness Day, family fun days, baby showers, parent support groups, family movie days, distributed educational material on various community events on substance abuse prevention. In Mon County, working with WVU School of Pharmacy to form a partnership and data sharing. Implemented Second Step and evidence-based prevention program at Shack neighborhood houses, offered after-school programs. In Preston County, the Preston County Sheriff Department installed a med return collection box at the Kingwood office. Implementation of Family Life Expo with focus on family wellness and substance abuse prevention. With family-focused prevention activities, it is held March. Attendance last in March was 550 people. In Randolph County, home of the nation's first tobacco prevention breast cancer awareness barn, 100% of Randolph County's parks are tobacco-free. Coalition youth involvement has grown 75% in the last 3 years. In 2011, 100 best communities. In Taylor County, we had Sinar, we went to WV Rays, SAD and MAD candle lighting visuals. In Tucker County, passed tobacco-free parks in 2013. Established the Tucker 24/7 Youth Mentoring Group. Conducted community workshops on dangers of meth and safe storage of proper disposal of prescription drugs in 2012 and 2013. Upshur County, passage of Upshur County Clean and Indoor Air Act. Red Ribbon Week, participation of all county schools and the community. Now I'm going to hand it over to Matt, who will talk about our youth coalitions in our region.
Good afternoon. Our youth coalition started off as NYLI, National Youth Leadership. To start this off, I just want to say this all could not have been worked out without my friend Greg. He started this all, and I just want to thank him for starting this. Without this, we would probably be just going out there our days, just normal, nothing getting done, just things that haven't really worked out in our schools. I just want to say thank you, because without this, I wouldn't be able to help my high school. No, and across the regions. I want to start off with Harrison County. Do I just click on this? Just hit the arrow. All right. Harrison County Dream Team, Teen Encouragement, the WVU National Youth Leadership Initiative. This is one of our closest teams, Harrison County. We've been with them for a very long time. National Above the Influence Day, CADCA Ideas Fair, February 2013 presentation about the underage drinking and designated drug problems in Harrison County.
In high school, all you would hear about is how high someone is or how drunk people are.
You're trying to stay strong, but it's hard.
It became a lot easier for me just to give in, and so I did.
I lost a lot of friends, and I didn't like who I was becoming.
I realized I'd be okay if I didn't do all that stuff, and people seriously respect you for that.
And there are people out there just like you.
You aren't alone.
And every voice matters.
You will find that those obstacles that you face don't have half the strength that you have.
There's so much more to life.
I've been able to follow the path that's in front of me. and it's been pretty great.
Next thing I want to talk about is the WV SAD. We also worked with them. We went to the Capitol, we worked up there, met a lot of people, made new friends. Oh, it's always good to make friends. Turning point of Preston County, taking charge. America's Promise Youth Coalition, working together today for tomorrow's youth. Bottom left corner is my favorite. Tucker 24/7. Special regional projects. Prevention workforce development training and education from monthly training. Community readiness assessment, SINAR, and we got police change, military health literacy, intervention, WV, sorry. What's Alright. We'll let Gavin take charge of this one.
Yeah, I'll talk again. In our region, we have a lot of different interventions that we have. We have WV SPURT, we have prevention-based school resource officers, we also have juvenile drug courts. With WV SPURT, West Virginia SPURT project is an integrated collaborative approach between community-based behavioral health centers and rural community-based primary health clinics, and trauma units and school-based health clinics. In juvenile courts, we have Harrison County, and we have Randolph County, and we have Mon County that are all in our region. We also have our resource officers in some of the schools, which are for helping kids with prevention and mentoring and just things like that for them to talk about.
Go ahead.
Go ahead.
I mentioned prevention resource officers. I had a resource officer call me last week with a good story. A young lady in his school, actually, I was on the phone with him at the time, and the young lady knocked on the door and said, "I need to speak with you." And the officer said, "Sure. Hey, Elizabeth, I gotta go. Can I call you back in a bit?" And I said, "Sure." So he hangs up the phone, and I get a call from him a couple days later, and he says, "Wow, that was an intense call." And I said, "What are you talking about?" And he said, "That call that I took while I was on the phone with you." And I said, "Sure." I said, "What was intense about it?" And he said, the young lady that spoke to me asked me to close the door and said, I need some help. And he said, "Well, what can I do for you?" And she said, "I've been addicted to heroin for the last 3 years." She's a junior in high school and admitted a problem to this prevention resource officer. I tell you that story because she was able to be referred to a juvenile drug court where she had an intense, a brief assessment where she could be then referred to treatment, and has been so. So without that officer in that particular school at that particular time, that child felt good enough and comfortable enough with that officer to go and disclose that with them. So I have to reinforce that particular intervention and prevention part of our continuum. Too often we forget that particular individual, it only takes one person to direct a person into treatment. And it happened to be that officer, and he asked me to share that story with you today. So.
Now on to treatment in our region. We have the United Summit Center, Valley Healthcare System, and Appalachian Community Health Center. United Summit Center just does substance abuse, outpatient services, and residential services, like the DUI program, early recovery, inpatient referral services, drug and alcohol assessments. Valley Healthcare System, over the years, Valley has continued to add array of services for people with disabilities, including services for individuals with disabilities, mental health, and chemical dependency issues. Valley serves the citizens of Mon, Marion, Preston, and Taylor counties in 28 different sites, including outpatient services, group homes, day treatment programs, residential treatment centers, and in the community and people's homes. Valley employs nearly 500 full and part-time staff who are comprised of of health care assistants and recovery coaches, service and care coordinators, certified counselors, rehab counselors, licensed psychologists and social workers, therapists, nursing staff, and psychiatrists. For Appalachian Community Health Service, they do individual family counseling, women's programs, DUI classes, psychiatric services, and mental hygiene and emergency services. For recovery, do you want to talk about the last one?
Yeah. So part of this presentation was to ask our partners to provide some information. And one of the quotations that stuck out to me was, recovery is possible. People change and improve their lives. Their past does not define them, and recovering people have many strengths and wish to become happy and usefully whole. And I thought that was a good example. We have a couple of different recovery programs I want to highlight. Celebrate Recovery, which is across our region. It offers a person opportunity to participate in group fellowship where love and hope combine with God's purpose to mend the lives. It's faith-based, and they're a big partner not only in our recovery community and in our communities, but they're also a partner on our prevention coalitions as part of that. The Hall Neighborhood House, which has a recovery coaching program, as many of them do. The program practices a non-judgmental approach, meeting the peers where they are. They have a strong, diverse team of recovery coaches with unique skills, recovery histories, and lifestyles. I asked one question, if you could wave a magic wand and fix anything about your organization or anything about your particular thing, and if you want to see more about this presentation and some of those answers, including in the treatment category, I encourage you to look at this. It'll be made public on Prezi as well as on our website, so I wanted to let you know that, harrisoncountyfrn.org, another commercial. We wish we could provide, the answer to this question was, we wish we could provide transportation to assist our peers, as well as help our peers across access more affordable housing. Removing barriers and providing a safe place to work on the recovery lifestyle with some of the everyday pressures is essential for success. The Opportunity House, I asked Matt to, at the very, very last minute, if he could provide me some feedback. We couldn't get anybody, with time constraints, couldn't bring anybody with us. So these individuals volunteered to tell them what recovery means to them, as well as what the Opportunity House has provided for them. The mission for the Opportunity House is to provide a safe and supportive environment to those working and recovering from addiction. We assist residents in working a personal plan of recovery, provide support in clearing up past issues, and help them to develop the skills needed to lead a successful life. We also offer a community recovery center open to the public for education. And I have to say, this is a long-standing piece in Buchanan, West Virginia. It's been there for at least the last 10 years that I can remember, where I first entered into this, well, actually, it's become a way of life, not just a profession. So when I first entered, that was my first interview, was with the Opportunity House and the leader there.
I'm here with Terry. He's one of the veterans in our Healthcare for Homeless Veterans program. Terry, can you tell me a little bit about the circumstances that got you into recovery?
Yeah, I've been drinking and using for 28 years of my life. My wife had passed away from the disease of addiction. I wanted to help, but I didn't know where to find it. I ultimately looked to suicide as a way out. I was actually admitted to the VA hospital in Clarksburg, and I was admitted to the 5th floor. Went through a severe mental illness program there and the PTSD program, and ultimately I was homeless. They had suggested me coming here to the Opportunity House. At first I was really skeptical. I thought I would feel trapped. stuck here. But since I've come here, it's the best decision I made. I've got coming up on 11 months clean. Go to 12 meetings a week. The recovery here is phenomenal. I couldn't think of a better place to be. I left for 2 months to go back to the VA for another program. And they asked me where I wanted to go next. When I graduated that program, the only place I could think of was the Opportunity House. With the coordination of the Opportunity House and the VA, my medical care is provided for me through the VA, and the Opportunity House work together. And I mentioned my wife earlier. You know, I wanted to quit, didn't know how to go about it, but when I come here to the Opportunity House, Matt introduced me to some programs, and you know, ultimately I'm clean for 11 months. I've never been that clean that long before in my life, and I'm very thankful and grateful for being here. It's helped me, and I've seen it help several other people that's come through the program. And I think that's it. Is that okay?
My name is Crystal Kinley, and I live here in Buchanan. I'm in the apartment program. From the time I was 12 years old, I've been an addict. I've been addicted to drugs. I've tried many times to get clean, many things to get clean. I've put tattoos on my hands, so I quit using. I've moved to New York only to drive back just to use. I came into recovery January 8th of 2012. I went to a fellowship home where I lived for 9 months. Whenever I came to the fellowship home, I was homeless. Even after, you know, as I was leaving, I had a trash bag full of clothes. The Opportunity House had an apartment program, and I was told about. Being here in Buchanan has given me so many opportunities. The ability to have a home for the first time in I don't know how long. I also was given the opportunity to get my kids back into my life and be a mother again. And coming here to the Opportunity House and being in the apartment program has been an amazing adventure. The fellowship alone, the recovery community that I have here, and to know that I never have to be alone ever again. It's very amazing to be a productive member of society, to hold a full-time job, and to be a mother.
So together we can create a healthier West Virginia. Without working together, we won't work on this. We can't. It's a continuum. One job doesn't make a success. And you know, Gavin only covered a blip, a fraction of what prevention does on the front end of things. And even though I've listed a lot on the slides, there's not enough room to put all of the successes of our prevention coalitions. Evidence-based programs in all 13 counties, a military outreach, health literacy outreach program, which was kind of just an accident. I went to a different coalition meeting, ran into it, and hey, I can pay for this. And then I left the meeting and said, I probably should ask if I could pay for this. So I then asked if I could pay for that. But without that, I wouldn't have had even thought about that initiative there. Without Joanne McNeamer, who is my partner in crime at the moment, she's sitting over there, and then all of our prevention coalition leaders. And across the continuum, we're starting to work well together. And I say we're starting because there's so much more we can do. And I look forward to the future of what we can do, what we can accomplish. And instead of just talking the talk, action is eloquence. Albert Einstein, I'll leave you with that. Thank you.
Let's give a special round of applause for these young adults. That is the future of our effort.